As we already know, the rabbit teeth are radicular, elodont, and ipsodont. That just means open roots, which we call apses, ever-growing teeth, and long crowns. Because of that unique anatomy and physiology, rabbits are more prone to develop dental disease, as we already covered previously. When incisor disease occurs, typically the maxillary incisors curl outwards and then mandibular incisors grow forward. The incisor malocclusion can be, again, congenital or acquired. The congenital incisor malocclusions usually are due to a mandibular prognatism or a disproportionately long mandible in relation to the maxilla. The surgical removal of the incisors is the treatment of choice for congenital malocclusion, and the procedure is usually straightforward. Just remember, rabbits with this condition should not be bred because it's likely they're going to pass that along to their offsprings. When you have acquired incisor malocclusion, that means that the upper and the lower incisors, they fail to meet correctly, if they meet at all, and they grow in an abnormal way. Incisor malocclusion can also be the result of a traumatic injury, such as fractures, either to the teeth or jaw. Paradoxically, incorrect tooth trimming can cause malocclusion and dental disease, especially when dental clippers or nail clippers are used instead of the disc to trim the incisors. Older rabbits with acquired malocclusion are more likely to have complications as the teeth can be a little bit more brittle and prone to fractures. In rabbits with acquired dental disease, it is important to warn the owner that the incisor malocclusion may only be part of the rabbit's problem, meaning it might just be the tip of the iceberg. You always need to assess and evaluate the premolars and molars and make sure you don't have malocclusion there. Because if you do have problems to the cheek teeth, correcting and trimming the incisors or even extracting the incisors is not going to correct the problem. In case of acquired dental disease, the incisor extraction should only be performed and attempted after you try clinical management. That means after you have trimmed the incisors or trimmed the incisors multiple times, and after you have addressed husbandry. Again, just extracting incisors, it's not going to correct the problem if you have husbandry problems, if you have cheek teeth malocclusion. It's really at a whole evaluation and making sure you covered all the bases.